Okay, I think this is better. My name is Muhammad Hassan, and it's my honor to be, maybe for the 5th time, the instructor of Part 2 course, preparatory course for MRCOG Part 2 exam, which will be held in January 2019. As I said, this is my 5th time with a respected, valuable mid-exam expert group, which are mainly one of the leaders in the internet or via the internet learning and e-learning methods. So it's my pleasure and my honor to be here today with all of you. And I hope this patch of our course being more valuable and concentrated directly towards our target, which is to pass and clear MRCOG Part 2 examination successfully. All of you knows that MRCOG, one of maybe the most famous certificate all over the world in our career in Ops and Gynae, and it's not an easy exam. By all means, it's not an easy exam. Maybe it is not very difficult, but of course, it's not an easy one, especially Part 2. Part 1 is like a preparatory examination to understand what is going on in the UK and how the candidates, trainees, doctors in UK dealing with different cases and situations, the basics and principles of Ops and Gynae working in the UK. Part 3 is a mixing between your skills, communication, speaking, acting, and a little bit knowledge. But Part 2 examination is the principal exam of this certificate. It's mainly depending on the knowledge base, information gathering, understanding what is exactly needed from each trainee in UK. So if you are practicing your career in UK, I think it will be more easy to pass. But if you are one of the overseas like us, like me, exactly, like Dr. Zaip, which will join us within few seconds, the overseas candidates have to find someone to bring them to the right direction so that they can clear this exam in the easiest way. Sorry, Dr. Naveed, you can't hear us. Is there any problems within the voice? Please, if there is any problems, just note me on the chat wall, please.
Your voice is clear, Dr. Hassan.
Good evening, Dr. Hassan. How are you?
I'm fine, alhamdulillah.
I miss your voice, by the way. Yes, Dr. Hassan is the man who is building up this course, actually. And we said, in Arabic, we said, this is the man in Khawalis. I mean, behind the camera. So, deep appreciation to all of your efforts, sir, and to all those warriors behind the tent of all team of exam experts. Thank you so much.
Thank you, Dr. Hassan, for the compliments. Actually, we always try here to help the candidates to make things easy for them so that they can just clear this stressful exam in a first attempt or easily. What we have learned in these past years that this exam requires a precise and accurate study. There are many distractions, many material around us. So if no students don't have the guidance, they'll keep wasting their time, energy, and at the end they'll get frustrated and maybe leave this path. So this is the whole concept and intentions behind this journey, or you can say the initiative. And so far, we are doing good. We have we can say conducted courses since last 2 years, and many of our candidates have passed the exam in the very first attempt. Recently, we have also started a part three course as well. So we're hoping to have the good results. Dr. Zib, I guess, has got some emergency, so she has not joined us so far. Let's not, we can say, waste more time, and we will start. And once she'll be in the session, we will hand over the session to her. So once
Yes,
again,
this is the life of ops and gynae doctors, Mr. Hassan. So
exactly.
maybe you cannot ever predict your exact times, your daily work. So I can imagine what Dr. Zaid suffering from now. So it's fine.
Yes,
Thank
yes,
you.
yes,
Yeah.
yes, exactly. And thank you so much to all of you that you spare the time and join us in this session. We welcome you all, and let's begin. Uh, Basically, agenda of today's session is about MRCOG Part 2 exam, and we will be discussing uh, about firstly what exam is about, how to apply, application procedure. Then we will be discussing the syllabus and the format of the exam, because that's the most important part. If you know, for every exam, the student must be clear about the format and the syllabus, that what he or she has to study and from where. Then we will be explaining what is the best way to prepare for this exam. Dr. Hassan and Dr. Zaid will give some tips. And at the end, we will explain about the online course, which is going to start on 15th of October 2018. So, Dr. Hassan, over to you. You are
Okay.
the leader of this course, so please go ahead.
Yes, thank you, Dr. Hassan, for this introduction. As I said, the Royal College is a highly respectable all over the world, and it's a significant qualification, actually. More than nowadays, more than 15,000 are carrying the membership of the Royal College and spreading what they are learned during their journey all over the world to improve the woman's health everywhere, either in obstetrics or in gynecology problems, and how to deal properly according to a highly evaluated guidelines, different guidelines actually, which always being updated to improve the qualities, improve a better life for a woman. So um, it's a challenge. This exam is a big challenge in your career, in your life. Actually, you should know a few points prior to start this journey. Please forget everything about part one examination, because part two could not be compared to part one. Part two, different sources, different books to study from, and all what you need to know is very simple. Number one, what are the proper sources? And we will discuss every point in this session. What are the proper sources to study from? The most important thing is to understand what is the exam needs from you. You are not a consultant. Even many of you may be a consultant in their countries, in their hospitals, but when you enter this exam, you should forget completely that you are a consultant. Actually, you are an ST5 trainee in UK. So you should act according the possibilities capabilities of the ST5 trainee in hospitals of UK. This is very important because in many questions, your answer is typically right, but they didn't or they don't need this answer for this exam. You have to choose more simple answer. So you will miss this question. Study groups are very helpful, but please don't stuck in many groups because wasting of time, unconcentration with difficult opinions, difficult questions, difficult discussions. So I suggest 2 groups are more than enough. One you choose, and another one will be our private group on the Facebook. I think this is more than enough. The last thing, or the 4th point, is believe in yourself. And this point is a general point. This is not for this exam only. This is in your life at all. In your career, working, with your children, in your family, everywhere. Believe in yourself. Trust in God. Believe in Allah that you can do it. Like everyone who are passed all through these exams, you can do it and you can pass by the God's grace. So this is a general information. Then we can talk about application procedure. Actually, you should, after taking a part 1 examination successfully, you should apply for a part 2 after 4 years of experience, continuous experience actually. And I know maybe some of you suffering already completing this assessment of training form, but if for those who are not still completing the assessment of training, there is a deadline for each exam, 6 months, I think, prior to the date of exam. You should send your papers completely through DHL or something towards the college. Then you have to wait for the results of evaluation of your papers about 6 weeks, average from 4 to 8 weeks until the results, either by acceptance or refusing your assessment of training form being received again. So for part 2 exam, deadlines are 8 weeks before the part 2 exam booking deadline. For January 2019 exam, closing date is Thursday 23 August, so it is already passed. So for those people who are planning to go through July exam 2019, please being updated within the RCOG website for the deadline for assessment of training. The assessment of training requirements includes part 1 MRCOG exam results as you pass it, 4 years of training, and the English form of foundation years training in your country, whatever, in your hospital, all of, and fulfilling the application of assessment of training form. The form is specified to each one. I mean, you cannot take a copy of the form of your friend because everyone should apply by his registration number identity. Simply, you will go through your account from RCOG website and downloading the training form. You can apply it either through a typing on the laptop or by hand writing black ink pen every word in a capital letter, all in capital letters with a black ink pen. Okay, then after you are receiving the assessment of training successfully accepted from the Royal College, you will then being able to pay for the fees online and being able to attend part 2 examination. This is I can see here the fees of the exam according to the band. So UK candidates will apply for 460 sterling pounds, and if you are an overseas candidate, you should search for your country according to the different bands. Band A, Band B, and Band C, it depends on your country of origin. For example, I'm from Egypt. So Egypt in Band B. So I have to pay 427 sterling pounds. So pray, all of you pray for God that you will be in Band B or C, because Band A is very expensive as well. I think, yeah, 464. So I think, I hope Egypt in Band C as well, but unfortunately it's in Band B. So you will catch your country from the different bands, and then you have to pay this number, the fees number, by the online credit card or debit card prior to the exam when the application date is open. Part 2 MRCOG has different venues, UK centers and international centers, mostly Bangladesh, Egypt, Hong Kong, Saudi Arabia, Dubai, in United Arab Emirates, Sudan, Iraq and Jordan, Malaysia and Pakistan are the commonest centers and always being in the list of international venues. Sometimes it have been changed from a city to another one in the same country. For example, in United Arab Emirates, sometimes it's in Dubai center, and another times in Abu Dhabi center, and so on. Like that in India, sometimes in Mumbai, sometimes in Calcutta, and so on. So this is about the online application for the exam. After that,
Yes, I just want to add one thing that regarding the AOT assessment, RCOG has not updated the deadline for the July candidates. So most likely they will update in a month or two. So you can just check from the website in a couple of months. Regarding the application for MRCOG Part 2, its deadline is 18th October 2018. So please make sure that you complete it before that time. And as Dr. Hassan already explained, this time, since the last 1 year, 1.5 years, they have made things very easy. You can pay online, and you can do most of the tasks from the websites. For AOT or whatever communication or the form you are filling, make sure that to download the form from your own profile, because each form have a specific serial number, and that maps to the your college number. So if let's suppose you are using form from your colleague, so the serial number will be of your colleague, not yours. So later on it can be complicated, and you might not get a chance to appear in that particular exam. So the exam date for MRCOG is 29th of January 2019. So approximately you can say October, November, December, and January. Still 4 months are available. So it's a good time. If one can study hard, they can crack it. So
yes.
yes, Dr. Zan, over to you. Basically, next one is the rules for the trainees, UK and non-UK.
Yes, thank you, Dr. Hassan. And another thing I would like to add, uh, okay, nowadays in the college, they are so stressed. They are suffering from too much crowded candidates, too much crowded exams, results, preparations, courses. So if you would like to apply for the assessment of training, or even if you would like to apply for exam, it as early as possible, because they may need more than expected time until they answer you about the results of your application. This is a common problem with many of our candidates and our colleagues due to the unarranged situations now in the college. So this is the assessment rules according to the UK trainees and the non-UK trainees. You can read it. Yeah, you will choose when you are fulfilling the application. Of course, the non-UK trainees, unless you have a trainee number through the GMC and you are practicing the career in UK. Okay, so we have a B route actually. Okay, after doing both steps, now you are able to take the exam, and the most important step is studying hard for this exam, and preparing according to the curriculum. Now we will discuss the exam format and the curriculum according to the RCOG website. The exam format, we have two papers. Paper one, actually, a gynecology paper, which consists of two parts of questions. Single past answer questions worth 40% of the total mark, and extended matching questions, or EMQs, which were 60% of the total mark, as well as in the second paper, which is an obstetric paper, by the same question type. Each paper, you should take it through or within 3 hours only, and you have a 1 hour rest between the two papers. After that, your exam is finished. 6 hours of hard working, hard thinking, great effort. You should be very well prepared to cope within 6 hours of working. This is one of the major obstacles of this exam. Maybe if this exam is 8 hours or 9 hours, it will be more easy, and many candidates will clear it in a simple manner. But the time is always against you. So this is one of the principles that we will try to overcome during our course. Actually, we will try to train how to answer a lot of questions in a very limited time, to prepare each one to overcome this obstacle easily, and even to finish each paper within 2 hours or 2.5 hours maximally. Okay. Then the exam syllabus or curriculum, you can see all domains are recovered during the syllabus, starting from the medical parts like obstetrics, antenatal care, maternal medicine, management of labor, maternal medicine, fetal medicine, postpartum complications, including also a gynecology domains, oncology, urogynecology, endocrinology, subfertility, early pregnancy complications, and contraception, up to the paramedical components, including risk management, audits, teaching materials, appraisal and assessment, ethics and legal issues, and finally, some of core surgical skills and techniques, and post-operative care questions. So these are simply our syllabus, and we have to cover all these topics prior to get inside the exam. How to prepare for this exam? It's simply It's simply number one, where to study from. You can see in the slide in front of you, all of you, these are the recommended sources. The Green Top Guidelines, which is considered the highest rated source and should be followed with any confused or debatable situation. For example, in postmenopausal bleeding guidelines, we have a Green Top guideline and we have a TOG article talking about the postmenopausal bleeding. What shall I follow? You should follow Green Top guidelines. This is the most valuable and proved source to study from and to be followed. So Green Top guidelines, your first step in studying for the Part 2 examination. Then the NICE guidelines, which is not specifically published for OBS and gynae. NICE guidelines, it's an abbreviation for the National Institute of Clinical Excellence. Clinical, it covers mainly all branches of medicine, neurology, nephrology, psychology, everything. So we have a selected topics we should follow in from the NICE guidelines, mainly 5 or 6 guidelines only, which are important in our exam, and we will refer to them during our sessions. Number 3, I highly suggest that Strategy, an e-learning website from the Royal College, should be studied from it well, and you should make a membership within the Strategy website. It's not that expensive. I think it's 103 sterling pounds per year, but it's highly effective. Many questions with many answers and explanations, covering all topics in a simple way and very helpful. Very helpful. If you sometimes you can only use Strategy and our course without even reading Green Top guidelines and NICE guidelines, and you will pass. I think this will be more than enough. Number 4, the TOG articles or the obstetrician and gynecologist. From my poor point of view, actually, I think this is the cornerstone source for the exam question. If any one of you entered this exam before, you will understand well what I mean. Many questions in single best answers, many questions in EMQs are from the TOG article. At least the last 3 years, sometimes with important TOG articles, and we will discuss them later, with an important TOG article earlier than the 3 years, you should know about them. You should read them very well, because maybe they are the only source for this topic. For example, 2013 perforated uterus article. This is the only source how to manage suspected perforated uterus during evacuation, during hysteroscopy. So we have no other choice to study from rather than this article, although it may be 5 years ago, and so on. So we will try to cover these articles. We have a summaries, updated summaries for these articles. So you will find it very easy later, and you can just follow our summaries to cover all important TOGs without any problems. These are the recommendations. These are the recommended sources. And the last thing, the practicing questions. Single best answer and EMQs books everywhere. I will, from the experience of the last exams, I will recommend some books to be covered, and they are top quality questions. This is, I think, the most important sources. And don't forget, of course, this is by red color. Most important source of question is from real playground. Wow. So recall should be answered and understand it very well. And this is actually what we will do in this new patch of our course. In previous patches, we didn't cover the recall very well because I believe recall never being the key to pass. Yes, they are important to understand what is the college thought towards this exam. But actually, recalls may be changed. So you cannot depend on recalls as in part 1 exam. But actually, in this patch, we will at least answering 3 to 4 exams, 2018, both exams of 2018 and both exam of 2017 in a different manner, open discussions, how to think in questions, and what are the possibilities, other possibilities of each question that may come in new exam from the recall. So this is a very powerful point. Maybe we can see now the different books and you can take a look. So if you didn't have these types of books, you can buy them. Okay. Yes. Okay. The idea of our course, okay, you will never gain the maximum benefit of our course if you don't follow the instructions during the different sessions. Sometimes maybe my instructions or our instructions, me with Dr. Rupal, Dr. Rabia, in different cases and different situations, being against your point of view. Sometimes my opinion from the exam background being different from the guideline itself. Sometimes the guideline is not that clear enough to be understood in a good way. So, number one, you should follow the instructions as much as you can. So you will minimize the possibilities of losing marks in the exam. Number two, you should believe that you have two enemies against you in this exam. Number one, your feelings towards this exam is very tricky. No, it is not. It is not a tricky exam. It's not a Middle Eastern system exam. You are not getting an exam in Egypt, for example, which every question is very tricky because examiners are not intended to make you fail or not to passing this exam. Absolutely not. So you only should follow the signs and the keywords given in each question. If you follow these signs properly, you will answer this question, even if you don't know anything about the information or the title. So, and this is what we will train for in our course as well. In this patch, we will try to minimize the information and the different discussions, and we will make a shift to more questions more answers, more discussion in a different or difficult situation that you may face in this exam. I think it will be a good improvement in the quality of our course. The second enemy is overthinking, because of your feeling that every question carry a trick behind it. So you may overthink in each question. Then you will never choose the simplest answer, which is almost the true answer. So take it easy. It's just a question. It's just like a case in your clinic. Just think simply, being relaxed and comfortable, and you will do it. The last thing, don't be depressed by anyone around you. Everyone has his own experience. I mean, sometimes you may take a look to your friends around who does the exam and fail to pass once, twice, and maybe 3 times. Then you will say to yourself, oh, it's very difficult to be achieved successfully. No, it's not. Different experiences, different backgrounds. You cannot compare yourself to anyone around you. So just trust yourself and don't look around. Prepare well and follow our technique as much as you can. I'm not asking anyone to study hard. Reasonable studying with a proper technique in the studying is more than enough to cover all possible important topics, hot topics, and to answer questions in a good way. So, I know all of you have work, families, responsibilities, and this is very difficult to arrange your time of studying within all of these responsibilities. So again, I'm not asking anyone to study hard, to spend 10 hours per day in studying. You are not in a pre-graduate examination. You are in the postgraduate exam. So act like a postgraduate candidate, a mature one, and follow the instructions. Okay? Then I think Dr. Zaid has a specific tips from her experience. The last thing here, you can see here in the slide, we will make a revision, yes, but not an ordinary revision. We will make a revision. The difference is clear here in front of all of you. Revision means re-evaluation, recognition of different points, understanding the guidelines from different point of view, how to answer the question from a smart way, even if you don't know about the main title or main topic, but you can still answering these questions in a true way. These are simple, needing some training, needing some tricks to be given. Everything will be with you, and by training, by effort, a little bit effort, a much concentration towards success, you will do it successfully, and you will celebrate very soon. So this is our aim of our course. The revision is our aim actually, and within continuous work together, me, Dr. Rabia, Dr. Rupal, Dr. Zaid, and all of you, we will cover everything, and actually we will be in a safe zone prior to January exam. Uh, I think this is a tips by Dr. Zaip from her experience, her own experience actually. Um, she recommends.
Yeah, Dr. Hassan, she has joined us. Dr. Zaid is with us now
Okay,
in the
okay.
session.
Oh,
Yeah.
Okay, good evening, Dr. Zaip. I'm sorry.
good
I,
evening. Hello, assalamu alaikum. How are you, Dr. Hassan?
how was your theater? Is it everything is
Yeah,
fine?
yeah, alhamdulillah, everything is fine. You know how obstetrics
Alhamdulillah.
works. You know,
Yeah.
emergency cesarean section, breach in labor, so I had to do cesarean section, and then I hurriedly
Uh-huh.
joined the session. Yeah.
So you you
So,
you are following the guideline very well. You are following the
exactly,
Green Top
exactly.
guideline, updated one of
So,
breech
don't
delivery
ask,
very
don't
well.
ask. I have been the victim of this RCOG, so I follow these green top guidelines now. Really,
Exactly. Exactly.
religiously, I do follow.
I'm very happy to listen to your voice again. Please take the mic,
Same
please.
here, same here, doctor. Thank you so much. So, assalamu alaikum and hello to everybody. So, I can see there are so many.
Yes, Dr. Zaid, your mic got muted. Can you
I
unmute it? Yes,
can.
now it's okay. Yeah.
Hello. Sorry. So, I just want to say that I can see so many familiar names over here. I can see Sanam. I can see Samar. Samar is our student, mashallah. I can see Dr. Shmaila is here, mashallah. So it gives us very great pleasure to see everybody, whoever is present over here. So, I mean, they have been part of our Medicam family. So I have been in this Medicam family since long. So this is good. Dr. Naveed, how are you? Same here, same here. Thank you so much. So, like Dr. Hassan and Dr. Hassan Heather both has told you almost everything. So I'm just going to add up. I'm just going to add up from my own personal experience, first of all. And secondly, obviously, whatever Dr. Hassan has said, I completely agree with that. Obviously, we all know this is the Royal College exam. So naturally, we have to follow all green top guidelines. That is a must. Okay. And first of all, I just want to start with one thing. Whoever says that by doing only recalls, you can clear part two, it's completely wrong. Okay. And I'm sure so many people who ever has took the exam in the last year or this January or July will agree with me that by doing only recalls, you cannot clear this theoretical exam. Okay. So you have to have a very vast knowledge, very clear concepts, very good grip on every good topic, what RCOG wants from us. Okay. So I'm sure you must have gone through my post in the Facebook group, but still, I want to add few things over here as well. That it's not like by doing only recalls. Yeah, agree with you, Sanam. So it's not only by recalls because I have been, part of so many groups. So I have been in touch with so many people, and you all know that I am active almost in the groups as well. And many people ask me for this thing. Okay, can I do just recalls and clear the exam? Can I just do these solved recalls by somebody else and then I can clear the exam? I do agree solved recalls, whoever has solved, definitely put their efforts and time in it. But my perspective is that you have to that you have to do and you have to solve these recalls yourself. It will give you confidence. It will give you plenty of work to search for the particular topic and then find out the correct answer. And trust me, it will give you a good idea about a single topic. Okay, say if you are doing the recall, for example, you are doing the say September 2015 recall, and for me September 2015 recall was the toughest one at that time when I was preparing for my exam. Okay, because it had so many tricky questions, so many new things which I have never read before. So what I did was that when I was doing question number one, so what I did, okay, this is the question number one, and they are asking about the abruptio placentae, the recurrence. Okay, so recurrence, I know the abruptio placentae recurrence is written in where? In the Green Top guideline. So what I did was that I read the whole abruptio placentae guideline and I made my small points. Okay, small notes, important notes. So that is the beauty of this RCOG guideline. What you have to do is yourself is, okay, read the guideline first and then try to pick up the important points yourself and make your own small notes. That will help you in the end of the revision. Okay, that's how it goes. So you can even start by solving the recalls if you have already studied everything, and then you can go and then you can study like this. Or you thorough study guideline first, and then by the end of the finishing of that guideline, try to solve all questions from the available pool wherever there is. Okay, so they are not going to give you a proper, what I can say. I think most of you all can understand Urdu, so I will just say halwa. So nobody can cook halwa for you, and you guys come and eat. This exam is an individual effort. Okay, so in this course, what we all collectively will be going to do is to give you a good, the way how to think about exam, how to solve the questions, how to approach in EMQs, because EMQs are the toughest part in this part 2 exams. And trust me, many people fail in this part 2 exam because of these EMQs. Okay. And for, as Dr. Hassan always says, and I remember it from my heart, that in SBA, think about the simple stuff, simple thing, but in EMQ, go for the logical thing. Okay, go for the toughest thing. I hope I'm saying correctly, but that's what I remember. Okay. Yes.
Yes,
So Dr.
yes,
Hassan, I still
yes,
remember
you
from your
catch it,
lectures.
catch it. No, you did
Yeah.
it. So
Yes.
actually,
Thank you.
one of my seniors told. I'm sorry for interruption, but
No,
I
no, it's
remember it very well. One of
okay.
my seniors told me uh, uh, when I tried this exam and failed. I asked him why. He told me
Mm-hmm.
in a single best answer, searching for the simplest answer, and
Mm-hmm.
when you choose an answer, never to change in
Yes.
in a single test answer. But in
Mhm.
EMQs, almost your first choice is a wrong one. Try
Yeah.
to try to think if there is another logic answer
Hmm.
rather than what all people around you will choose. This is
Hmm.
this is the main instruction, and I follow this. So all of you should
Yes.
follow what Dr. Zaid said now. Thank you.
I also followed this. I also followed this, Dr. Hassan. Thank you.
Right.
Yeah. So that is the basic tip. Okay. So what you have to do while you solve the questions, firstly. Secondly, obviously, after doing green top guidelines, and when I say green top guidelines means all green top guidelines from number 1 to number 82 or whatever, whichever the number is. Okay. And guidelines keeps on changing. So don't go on the printed stuff, whatever is available in the market. I don't say that this is not good, but what I do is that whenever you want to read anything, go on the RCOG website and try to download it. It will be a fresh content, it will be an updated content, and it will be good for you, that you also will be updated. Okay? Because guidelines keeps on changing, first of all. Secondly, definitely nice guidelines. And from nice guidelines, there's a very small list which you have to do. But nice, by the name nice, is never nice. It's not nice at all. Because nice will always confuse you. Nice will not give you any recommendation. Nice is not going to give you anything that this is the thing which you have to do for the patient. Okay, so what you have to do is that you have to read nice guideline nicely, I don't know how many times. Okay, so nice guidelines is not nice, that's a done deal. So for the nice guidelines you have to read it so many times to have a good grip. And from the nice guidelines, topmost is my favorite, incontinence. Okay, the urinary incontinence, and Dr. Hassan will teach you a good the heck of this incontinence. Trust me, I still remember from his notes and classes, and Alhamdulillah, and I still do. Okay, incontinence, then comes infertility, then comes multiple gestations, then comes the hypertension, diabetes, cesarean section, okay, and preterm labor. And now I just want to clear one thing. Whoever talks about the antenatal corticosteroids from Green Top guidelines, which have been archived in 2009, come on, please forget about that. Now we have only one guideline about glycolysis, about preterm labor, and antenatal corticosteroids. That is only nice pre-term labor guideline. Don't quote your 2009-2006 RCOG green top guideline of antenatal corticosteroids and even tocolysis. Okay, forget about that, because I have seen so many people quoting that guideline from old books in the Facebook groups and here and there. Okay, and thirdly, this part 2 is number games. This part 2 is percentages game. So you have to make sure you have to have a good memory about all these percentages. I'm not saying about all percentages given in one guideline, but at least 1, 2, 3, 4, 5 important percentages. And what is that? Number one, if you talk about shoulder dystocia, what is the incidence of shoulder dystocia? What is the recurrence of shoulder dystocia? And what are the maneuvers? What's the success rates? That is the important thing. If nobody remembers this thing, trust me, he or she does not have any right to pass any exam, because that is the basic for the RCOG and for us as well as a clinician, as a clinician and obstetrician as well. Okay, so please be very peculiar and particular about few things, the recurrent topics which are very recurrent for the RCOG, and trust me, they will remain recurrent for us as well. Okay, so I have tried to jot down few important stuff which you have to do from the obstetrics and gynecology. Obviously, from the obstetrics part, you have to do each different bit. From the gynecology part, you have to cram your infertility, you have to cram up your incontinence guideline, you have to cram up your HMB guideline. And when you talk about HMB, everything about HMB. Then you have to talk about Mirena, then you have to talk about UAE, then you have to talk about endometrial ablation. Okay, so as Dr. Hassan said, that whichever topic is not present in any guideline, please refer to the TOG articles. Don't quote OGRM, don't quote American guidelines, don't quote Canadian or Australian or Ranzogi or anything. Okay, for God's sake, we are going for the Royal College England. Okay, we are going for the UK, United Kingdom, not the ACOG, not American or not Ranzogi. And please, OGRM, yes, I do agree, OGRM is a good, articles, but it is not recommended for us, part 2. So please don't go in detail, don't go in details, because what we have to do, whatever you have read in 3 months or 4 months or 5 months, that is useless for you if you have not revised that properly by the end. Okay, so recurrent, please mark my words, whatever is the recurrent, you have to keep it, on your tips. Recurrent topics. What are the recurrent topics? These, diabetes, hypertension, the cervical screening program, the your this basic points from the oncology, staging and the treatment. Okay, important guidelines, nice guidelines, maternal medicine guidelines. Okay, consent advices, percentages. Please try to memorize them and try to revise them again and again. If you have a study partner, well and well good, because by speaking we learn, by revising we retain. Okay, so you have to do what? You have to do all guidelines, you have to do related nice guidelines, consent advices, and please try to jot down your own points, because what is important for you maybe is not important for me. Okay, don't rely on available pool. That could be a helping pool, that could be a helping tool for you, but not soul everything for you. Okay, so because everybody has got their own mindset, everybody has got their own strong points and the weaknesses and all. For me, it has always been the numbers which have been the very difficult thing. And trust me, my study partner used to, kind of beat me at that time. No, you have to memorize this. You have to memorize this. Okay. And I used to do in some parts for her as well. So that's the beauty of the study partner. That is the beauty of the, the combined study. So if you have a good study partner, well and well good, try to study with her or him. This will be a good, and even for your part 3 as well by the end. So for part 2, do all important things stuff. Okay, remember, recurrent thing you have to do very nicely, and it should be on your tips, and it should be in your mind all the time. You have to do all scientific impact papers and do all 3 years talks, and some topics which are not covered in the last 3 years talks, but which are covered in old talks. And I just want to disagree a bit over here for about talks, because what I have found it that 60% of the paper is from guidelines and nice. So what I feel is that first we have to cram up all guidelines, and then by just going through the recalls, you yourself will come to know which topic is coming again and again. Okay, what are the important topics? Number one, uterine inversion. That is not covered in any guidelines, so we have to refer to the talk. Enhanced recovery program, that is not covered by any guidelines, so obviously we have the talk. So asthma, thyroid, inflammatory bowel disease, okay, and sutures and materials and everything and so many other things. But if OAB, overactive bladder, is very nicely written in guidelines, so why read again the talk? Okay, so that's how you will get confused. You will have so many resources. Okay, you got my point. So what I mean is that whichever topic is not covered nicely in the any guideline, so refer talks, but do all talks very well last 3 years, and the topics which are not covered in the old talks. And again, my point will remain same, that do solve recalls yourself. It will give you confidence, it will boost your confidence, and it will give you a good idea about exam and exam pattern as well. And secondly, don't argue much on recalls, because recalls are made by us, people like me, people like you. So we are not 100%. Don't rely on my memory, don't rely on anybody's memory, because whoever is writing the recall is just giving you an idea about the exam. Don't just, I see so many arguments, I see so many fights on silly things. Please don't do that, because recalls just give you an idea that which topic is recurring and which topic is coming again and again. Okay, for example, from gynae, ovarian cyst in premenopausal, postmenopausal will never leave you. NHS CP colposcopy guideline, it will remain hot favorite topic. HMB infertility will remain hot favorite topic. So obviously, these topics should have to be on your tips. Okay. Okay. So coming back to the next slides, then if you have done everything, I mean, you have read one guideline. So what I followed, and so many friends with me who have followed our, timetable on the Facebook groups. So what we used to do at our time was that we used to make our schedule and then follow that. For example, if we have one guideline today, for example, the sickle cell disease. So, the whoever is posting questions on the sickle cell disease, so that was the day for the sickle cell disease. So we have been floating in the sickle cell disease on that day. So it gave us, a thorough practice about the SPA and EMQ. Okay, so don't hesitate answering any question. Even if you answer wrong in your practice time, don't be shy, don't hesitate. At least you are, practicing your question. So by the end of the day, when you will get the key, so you will get the correct answer. So obviously you will look for it, you will study for it, and it will give you a good confidence on yourself that you have done well. Okay. As Dr. Hassan said, that there are so many books. Obviously, there are so many books, and there are so many old books as well. Okay, just let me add one thing. There are so many old books as well. So don't rely on keys, because keys may be wrong according to the old guidelines. So try to solve these EMQs and SPAs yourself, and then try to look the correct keys from guideline as well, just to cross check. Otherwise, most of the books are very authentic, very good. For the EMQ, what I recommend from the topmost, what I followed was Tahir Mahmood. I did it like twice or thrice, I guess, or maybe, I don't know, or more than that. P. Sinha is a good book, but again, in P. Sinha, you have to follow your keys, because EMQs are giving you just practice material. Any book is giving you practice material. Any book is not giving you the correct keys according to your guidelines. This is your job. This is your duty to correct all these keys yourself. Okay? So Tahir Mahmood was EMQ. I still like this book. P. Sinha is very good. Kalaivani is an old book, but it has good, a good chunk of EMQs, so you can go through them. But remember, again, make your own keys or correct the keys yourself. Andrea Pilkington, Succeeding is new book, but it has got some printing mistakes. But overall, it's a good book, and it will give you a good idea about exam. But again, don't go about its keys. Try to correct keys yourself. Rekha Buntankal is a very good book, and at my times in January, it was a very new book. So somehow I was unable to do that, but I did it once, like I mean, not thoroughly, but I did it once, and I found it very good. And you won't believe it has got so many questions according to our recalls. Probably they have modified the questions or what, but the questions are real good. Okay, so practice that. From SPAs, yes, Androsizer will remain authentic. Brian McGowan is 2017 book, so it's good. Mastering SPAs, very good book. But again, Mastering SPAs has got so many, vast knowledge and vast, what I say, the content. But again, it's a good practice for you, because for part two you have to have a thorough knowledge. Seema Sharma, it's an old book, but it has got 200 very good questions, so you can practice them. Dinesh Gupta is also a pretty old, or no, but I guess it's an old book. But again, practice. Amanda Jones, it's my very much favorite book. 200 questions, and it will give you a pretty much good idea about exam. Okay, so try to practice as much as possible. And again, the strategy will remain a cornerstone for your preparation. Strategy. Remember, when I say strategy, it means strategy questions, not strategy theory. Refer to strategy theory when you see any conflict in a question from your guideline, and or when you see any conflict in your question from any other source or top article. Then you can refer to strategy theory. And obviously, strategy theory is again theory. So, I mean, it's humanly impossible if you try to follow so many sources at once, isn't it? So, what you will do is, first of all, you have to cram your green top guidelines and nice guidelines first, and then tops, and then, there comes strategy, and again, strategy theory for those things which are, confusing you, which are giving you some tension, or which you think that you have to study from strategy. Okay? And another important part, there are so many groups, Facebook, Telegram, WhatsApp, Messenger. I'm not against all these groups, obviously, because I have been, myself, I have never been part of so many groups. But what I feel is, joining the group is not an issue, but following the group is an issue. Okay? So everything, whichever you start, and if you do not follow, it's useless. Okay, by the end of the day, what you will get from all these groups? Thousands and thousands of messages, and then you will start screening those messages, and in those messages, trust me, from 1,000 you will see, I think, quality content in 400 messages. So what about your time? And I'm sure most of you all are working, and some are moms as well, so it is pretty much difficult to follow all these groups. So my personal opinion and my personal, suggestion, humble suggestion for you all would be to just, restrict yourself. Restrict yourself. Do not join so many groups. It's a good in a way that you are having a good practice. But if you are not following these groups, it's useless. Okay. And again, find good study partner. Good study partner means, on which you can count on which on her or him you can count on, that he or she will back me up when I am down, and when he or she is down, I will back him up. Okay, so I will try to lift him from all these, because this is a difficult time, this is difficult exam. So at times we do feel low, we do feel that this is, I mean, we cannot do it. So definitely we need somebody who can boost us, who can buck us up, who can, lift us up. So definitely that only your study partner or a good friend can do. Okay. And even if you can't find it, be your own good partner. Okay. Be your own self-study partner. So what you can do is, criticize yourself, try to, rehabilitate yourself, try to improve yourself. That's it. Okay. And for the courses, so many good courses, so many good people around. It's all about that what you choose and what suits you. For me, med exam has always been good, and it's like a family for me. I took it twice, and it helped me. And trust me, when I say I couldn't have passed this exam without Dr. Hassan and Dr. Hassan, and I truly mean it, because they both have been my mentors, my teachers, my guides, my best friends. So it's always like a family in med exam expert course. And me myself takes part one class. So I am so glad to see so many my part one candidates here, and it gives me an immense pleasure that I'm talking to them again. Okay. So this is all about what I want to say for the part two. Med exam course, obviously, I will never say that this is a bad course because I have been part of it and I succeeded because of the med exam. Okay, so it's all depends upon what choose you, what course you choose, what time suits you, and what you think is good for you. Okay, we are all here to help you, to guide you, and to lift you up in your tough times. And hopefully, we can do that. And we have done it, Alhamdulillah. It's not like that. I mean, we have been part of this for the last 2 years, and yes, and we have been together. And I can tell you, there are so many candidates who are with us since part one, and they are not ready to leave us, and we are not ready to leave them as well. Okay, so it is good. It is good. So it's like being a part of a family, and it gives me a good immense pleasure. So definitely, I will definitely recommend everybody to be part of this course, and I hope it will be fruitful for you as well as it has always been for me and my so many friends as well. Okay, so that's all from my side. If somebody has any question, can ask me, and you guys all, our doors are open for you for any question. So here I am. Yes, yes, Samar. Thank you so much. Yes, yes, yes. So nice to see you here, Samar, Sanam, Shmaila again, Naveed. This is amazing. Thank you so much, Dr. Hassan.
Thank you, Dr. Zaid, Dr. Hassan, for both of you. It was a very good session, and you both covered the points, the tips, and curriculum very well. So I hope also that it was helpful for the candidates.
Yes. Is there any
Thank
question from anybody? We are here to answer, please.
Yes, thank
Anybody?
you
Any question?
so much. Yes, this is me. Thank you
Yes.
so much for this wonderful presentation, Dr. Hassan, Dr. Zaid. You are amazing as usual, and yes,
Hi, Dr.
definitely. Maybe your information changing my mind towards many things as well. So yeah. So the last thing I would like to add is
Mhm.
that, of course, I stressed about the too many groups, to be involved in too many groups. So you sometimes you're being very confused and wasting your time. But the most important thing that you should answering in exam questions, you should answering what is common, as you
Hmm.
said.
Hmm.
If I ask you about Prader-Willi syndrome and blah blah blah, if you didn't answer this question and you don't know anything about, you will never fail. But if I
Hmm.
ask about details of PCO or ovarian hyperstimulation, for example, and you miss these questions, you will fail. So
Hmm.
everyone should believe that there is a topic, beloved topics by the college, and
Hmm.
if you never answering this question in a true way, you will never pass. For example, in obstetric paper, for example, if you miss intrapartum management questions, infections with pregnancy, you will never pass. Never.
Exactly. Exactly.
In gynae paper, if you miss endocrinology, urogynae, cervical screening, you will never pass. So don't waste your time in sophisticated titles and studying sophisticated questions and missing the simple, easy questions. Sophisticated, difficult questions will be difficult upon all candidates, and almost 90% will never answer them. But the simple questions, like in subfertility, in endocrinology,
Hmm.
average candidates will answer it easily. So you have
Exactly.
no chance to lose these questions. And this is what makes somebody pass the exam and another one fail to do it. This is the very critical point. Thank you.
Yes, exactly. I agree. I second your thing.
This is
Okay,
the point.
so if you have questions regarding the last two sections about the application procedure, AOT, and about the exam curriculum format, and then anything you can ask. And after that, I'll just quickly give an idea about our course, what we will do. And one special thing we will add this time is that we have prepared the recalls, most of the recalls, with answers, explanation. So we will be giving you access for those. I'll explain in a while. So if you have any questions, let's discuss them first. I can see one question from Dr. Rabia. There's if we can extend the deadline for the course registration. Yes, we are looking into it, and as mostly students have not got the confirmation for the January so far. So most likely we will be extended it, and we will announce it on our website. Dr. Naveed is asking.
I think
Yes,
we were so clear, Dr. Rabia, Dr. Zaid, and me. So no answers at all, no questions at all.
Yes, I also. I'm
Question.
also wondering. Nobody is asking any question.
I think
Wow,
we are perfect. So we are very clear. Everything is clear enough.
very good.
No questions, no queries. Perfect. Perfect.
Yeah.
okay, then let's save time and proceed further with the course details, and then we will close the session. Let me allow to begin. Okay. Okay. So MRCOG Part 2 online course is of a 3-month course, and in which we will be having a live sessions. We will be guiding you on a Facebook group. The main and the principal, you can say, instructor for this course is Dr. Mohammed Hassan, and we will be having Dr. Rabia and Dr. Rupal as an assistant mentors, moderators in this course. And we all will be guiding you in the whole course on the daily basis in the Facebook group. Uh, Fee for this course is $195 per month, and there is a discount if a candidate wants to pay the complete fee as a single payment. The candidate will get $15 discount, and there is a early bird discount also. The date here is wrong. We have extended the date till October 6, 2018. So if someone registered before that, they will avail this discount as well. So the starting date for this course is October 15, 2018, and the registration deadline as of now is October 14, but most likely we are going to extend it so that more candidates can join this course. Okay, I'll just quickly discuss the features. We'll be having the live sessions like this one, and it's totally online. You can access it from anywhere. You will see our course content on our website that you can also access it anywhere. We'll be giving you a very good summaries of the topics from the curriculum. Plus, we will be giving you the access to the session recordings. Basically, what happens is that everyone is busy and sometime they are unable to attend the live session. So if you miss something, don't worry. The very next day of the session, you will get the recording on our website, and you can have its access to the course, and you can repeat and listen again and again as much as you want. We will create a study room Facebook group, and in that we will add all of you along with mentors, and we will start discussing, guiding you, because there is a gap between these two sessions. So in that gap, we'll be in contact, and we'll be in discussion, and we will be exactly telling you what you have to study and what schedule you have to follow. In the course, we will conduct topic tests. We will cover a particular topics, and after that, we will conduct tests from them so that you guys can assess yourself. Those students who have taken our part 1 course, they are very much familiar with this technique. We study one topic and then conduct its test and just move to the next topic. Here we will be conducting tests based on the 2 domains, gynecology and obstetrics. So once we will cover the topics of gynecology, we will conduct a test, then similarly obstetrics. At the end of the basically whole course, we will be having a final mock exam, which will be very similar to the Royal College exam. This will give you a confidence when you will go to the real exam room, and it will help you to rehearse this exam. The new thing this time we have introduced is that we will be giving you access to the recalls, and we have made the explanation. We are still working on that. Approximately 60% are already ready. So from 2015 till 2018, we will be discussing the recalls, and you will be able to access it on our website. Plus, we have also introduced a question pool from the Green Top guidelines from different modules, and we will be giving you access to that question pool. It will be a good practice for you. And as I explained earlier, there will be a final mock exam at the end of this course. Once again, just a quick repeat: Dr. Hassan, Dr. Rupal, and Dr. Rabia are the instructors. So total live sessions will be 22, and we will also see that if something's still left, we will conduct extra 1 or 2 sessions to cover that. Each session's duration is usually 3 to 4 hours. Fee is $195 USD per month. I explained discounts also. We have a $10 early bird discount. We also have a group registration discount. If you want to register as a group of 3 or more, then each member will get the discount of 25. And if somebody pays the complete fee as a single payment, he or she can get the discount also without the fee. This is the course contents. Dr. Hassan already explained. These are the same topics which our COG asked you to prepare. We will be having the discussions on the same topics. You will have a study room, similar. This is a snapshot from the previous one. So you will have a similar Facebook group for the discussions. And here is the procedure how you can join in our course. It's very simple. You have to open our website, www.med-examexpert.com. Then click on the course catalog button, and then you will see this on the right side. There are filters. You can choose MRCOG Part 2, and then you will see these 3 modules. This is for you can say this one for the full payment. This is for the monthly payments, and if you want to pay this in 2 installments. The procedure is that you have to create an account on our website. If you have already an account, you can just log in and pay, and you will be part of the course. And then over the email, we will be sending you the instructions and each and every guidelines about the sessions, schedules, everything. This is a list of candidates who cleared the exam from our last batch, and we had a very good batch last time, and the success rate was also very good. These details also available on our Facebook page. If you want to see, you can watch the results video. Some of the reviews from our students. If you just would like to know our culture, or if you would like to know that how our courses are, you can check the reviews on our Facebook group. We always try and do hard work and make sure that students clear the exam in the very first attempt. And we always expect that students put all their efforts, dedication while in the course, full attention, so they can get the maximum benefit out of it. That's all. Thank you so much. It was a very lovely session, and I hope you all enjoyed it and it was beneficial for you. And we will also try to keep arranging these type of sessions in the future as well. If you have any questions regarding the course or anything else, please let us know, and then we will
I
conclude
want
this
to
session.
add one thing, Dr.
Yes,
Hassan, if
Doctor.
you allow me, please.
Yeah, you sure.
Yes, yes. I just want to, say one thing. It's not like, if we fail any exam, it means we were not capable of that exam. Okay. So this is a message for, candidates who have, tried for this exam and they were, declared unsuccessful. And when I say unsuccessful, it means that we have just been unsuccessful in this exam. It means we have not failed our life, we have not failed part of our life or anything. We have been just unsuccessful. Our success has just been delayed, not denied. Okay. So don't lose heart. Whoever didn't make in the last attempt. So try to buck up, try to lift yourself up and fill the form. Don't delay because these days you all must have been seeing so many things from the RCOG. There are so many stuff happening here and there for the part 2 and for the part 3. So don't delay your exams. Whichever exam suits you, take it. Don't delay it. Okay. And don't lose heart if you have failed it once. I have failed it once, so I have no shame in saying that. I have cleared in my second attempt. So what's the big deal? By the end of the day, what will be written on our degree? Pass. You have successfully been declared successful in this exam. Khalas. That's it. Okay. So number of attempts does not count in your journey. It does not count in the MRCOG exam. What counts is your courage. What counts is your knowledge. What counts is your concepts. Because by the end of the day, by taking this degree, what you are going to do, you are going to apply your knowledge on your patients. So just think positively. If we are failing exam, it means God is making us very good in our field, that we serve our people, that we serve humanity with our good skills and good knowledge. Okay. So don't lose heart. So just lift yourself up, and we are always here to help you all. And one thing I just want to add, because so many people, know that I'm linked to med exam, and so many people ask me that maybe this is a scam, maybe this is a fraud. Come on, we are not fraud. We are always open on Facebook. Me, Dr. Hassan, and everybody, we are always, encouraging you, guiding you on the Facebook. We are not going to run away by taking your 400 or $500 or whatever. This is not going to make our life. Okay. So don't think like that. It's just like this course is helping us in every part of our life. So obviously if we are getting benefited by this, it means that we are going to do good in our exams. Okay. So this is the only thing I just wanted to add. If you guys have any question, please, we are open to any question. Thank you.
Yes,
Yes,
Dr.
three
Z, there's
months
a question
is
from
enough.
Dr. Samar. Yes.
Yes, 3 months is enough if you are not working. And when I say if you are not working, it means you are not working in a hospital like 24 hours duty. Okay. And if we are on call today, and definitely we'll be going home tomorrow. So naturally, it's humanly impossible. You cannot cover this stuff course. But if you are working like 6 hours or 4 hours or 5 hours in a day, so obviously it's good for you. You can take it. Try to stay focused, stay calm, stay good in your whatever you are going to do is. Okay. Yes, it is enough for me. I think this is good. It's not like that you cannot do it. Try for it. Nothing is impossible. Why nobody is informed us before, Dima, about what, my dear? You can open your mic and speak if you
Yes,
want
Dr.
to.
Nima, you can open the mic and let us know. We did not get your question. Inform us before about.
About what? About course or about syllabus or about what?
By the way,
Anyway,
we will be uploading this session on our YouTube channel.
yes,
So, in case if you miss or any part of it, you can just
hmm, yes,
watch it again. Within a day or two, we will upload and share the link on our page.
yes. Follow our page, so naturally you will get all updates over there. So thank you so much for patience. patiently listening to us and paying attention.
Yes.
And
One more question.
So,
What time does the course start,
uh,
Dr.
it
Sabia?
will, yeah, it will start from the 15th of October. Our first session is scheduled on
Time.
15th. Time, it will be 4 p.m. GMT.
Okay.
The same time of today's session, the same time. It
Okay.
will be 4 p.m. GMT.
Assalamu alaikum.
Yes.
I attend now because I don't know. I didn't receive any email, any message that there is session today. By chance, I check on Facebook.
No problem. We will upload the. We will share the link, and the part which you have missed already, you can just watch it again.
How we will communicate with you? How we will communicate with you?
You can communicate to us through our, you can say, Facebook group. You can just drop us a message anytime, and we will get back to you.
When we start this course, you will send email or what?
Yes. If you have already joined the course, you will receive the detailed guidelines in a day or two. Or if you have not joined, then you can just join it using the procedure we have mentioned previously, and also available on our page.
When and how I can watch this?
This will be uploaded on YouTube channel, and we will share the link of that video on our page. So what you have to do, just like the page. So whenever we will do a post, you will get a notification.
Inshallah. Okay, thanks a lot.
You're welcome. Okay, thank you so much to all of you. Let's close this session. And once again, it was nice to see you all here.
yes,
See you soon.
thank you so much, and all the best, everybody.
All right.
Yes, thank you so much for everyone for being here today and for your time, your effort, your attention. And I hope all of us were clear enough to clarify the picture, the principles of the course and the principles of the exam as much as we can. If there is any queries or any questions, of course, Dr. Haider and all of us will be able to answer these questions on the Facebook or whatever, even within the emails or something like this. Thank you so much, Dr. Hassan. Thank you, Dr. Zaid, for unforgettable session. Thank you so much for the efforts, for the preparation, and for everything. Not in this patch, for all previous patches as well. Thank you so much.
Thank you so much. It means a lot. Thank you.
Thank you.
Have a nice night.
Bye bye, everybody.
Bye bye.